When I was 8 days old, my parents had to let me go to a surgery that was to save my life. Part of me was falling out. TMI, not what you wanted to know. But many of you as parents have been in that kind of a situation. Letting your child go back into surgery as an infant, as a toddler, hoping for the best. More than 1 million children a year under the age of 5, this from FDA, undergo surgical procedures requiring anesthesia in the United States. The most common procedures include ear tubes for chronic infection, tonsillectomy, hernia repair, and circumcision. And as it turns out, anesthesia, we knew this. We knew this. As adults, we knew this. Anesthesia is not safe. General anesthesia is not completely safe. Bad things can happen. But that's why we have anesthesiologists. They research this, they learn about it, they practice their art, and they do their best to take care of us, as well as our children. We're thankful for them. But here's the problem. Animal research has been showing that anesthesia in young animals creates things like brain damage later on that you can measure. The question then becomes, does this translate to children? We sort of know what the effects on adults are, and many of us have been through surgeries with anesthesia. But in pediatrics, are we subjecting our kids to undue risks? Do we really understand the magnitude of the risks that they're going through when they undergo anesthesia as infants? So the US FDA and the International Anesthesia Research Society have created strategies for mitigating anesthesia-related neurotoxicity in tots, or SMART tots. I suppose it's a better acronym than MEDUFA. I always love MEDUFA, Medical Device User Fee Act. So SMART tots is going to coordinate and fund research to make surgery, anesthesia, and sedation safer for infants and young children. I have to applaud the FDA here. They're acknowledging that there's the potential for a danger. They're not saying, panic, stop doing surgeries on children. They specifically call that out. They say, no, we need to keep doing what we're doing because a surgery should only happen anyways if it's essential, if it's necessary to preserve the life and health of that child. So the question they're asking now is there more we can learn about anesthesia in infants and young children? So here's the Smart Tots website, funding research to ensure pediatric anesthesia safety. If you're somebody who's had a child under anesthesia, there's places where you can go as a parent. In this, under the resources section, there's a newsletter if you want to stay up to date on anesthesia research. Maybe you're a med tech company involved in surgical devices. Maybe you're involved in anesthesia delivery and you want to know more about this growing field. Because be sure that if they discover a correlation, things are going to have to change. The practice will have to change. And hat goes off to their research. There's not a lot we know today. There's a couple of questions on their FAQ which I wanted to bring to your attention. How did the concerns about the safety of anesthetic drugs for infants and young children arise? Well, one of the FDA's centers, as well as investigators at several universities, conducted research to study the effects of anesthetics on the nervous systems of developing animals. That's right here. This research demonstrated that exposure to some anesthetics and sedatives caused memory and learning difficulties and other harmful changes in the central nervous system of some laboratory animals. So, yeah, that's worth probably studying more. But, get this, currently inadequate data exist to prove or disprove whether similar effects occur in children. So no one is saying that we know that this is going to harm children. I've been involved in the past on research using animals, and it doesn't always correlate. It doesn't always correlate. When we think, oh, it's a biological system, it must behave the same way, it's not always true. So I think we do have to take all of this with a grain of salt. This is good precaution. This is good research to do. But please do not go out and freak out that because animals were affected by anesthesia, that children necessarily will be. It's amazing how different biological systems are, and I've seen that firsthand. Should we be concerned about risks to humans? Well, yes, I think it's wise to ask the question, but the studies have been mixed. Studies have not found a link between development of learning disabilities in children and the use of anesthetics. However, some study data have linked learning disabilities and behavioral problem with anesthetics administered in infants and children prior to 3 years of age. So they have a newsletter archive and a bi-monthly newsletter that you can subscribe to learn more. What can we learn as a development community? Well, I think we have to stay abreast of these things, because if we're involved in surgery, if we're involved in anesthetic delivery, we need to pay attention to know how the landscape is changing and what FDA thinks about it. Because you better believe that FDA, when they ask us during a submission, hey, how are you dealing with this question? You're going to have an answer. And so it's good to stay abreast of these kinds of things. If you like what you just heard, either as a parent or as a medical device developer or an investor or someone who's part of the MedTech community, please be sure to like and subscribe to us on YouTube. MedTech Crossroads is intended to save you time and headaches in your MedTech product development journey. So we want you to be happy with what you're hearing here. Keep the cards and letters coming so we can make segments that are useful to you and to those that you work with and to those that you love.